What's going on, guys? Dr. Thompson here with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy, what is it, Monday? Happy Monday. If you have noticed, we're going live a little bit earlier. Normally we do it in the evening, but the weather, the weather is not cooperating very well. So we actually are going to be closed in the afternoon. Just because we're expecting 5 to 9 inches of snow and negative 20-degree wind chill. So it is absolutely crazy. So it's been very cold for a while. Here in Illinois, the snow just keeps piling up. So we're going to be heading out of the office, and so I promised that we would be going live, and I am making it happen right now. So thank you guys for joining me for this live. Many times we go over like conditions, and anytime we go over just to help you understand your body, your physiology, and things like that. But I'm going to give you a little bit a different perspective on how, what we do within the Wellness Way on really trying to figure out a person's health. And so the title of today is Fire Department Questions That Demand, let me get out of the way, Carpenter Answers, okay? So the reason why I wanted to go over this is I get a lot of Facebook messages. I get a lot of people, even patients, people at our gym, they ask us questions that really I call them fire department questions. And the reality is you need a lot deeper answer with a lot more context actually behind it. And this is certainly true when people say, well, I'm having some gastrointestinal issues, some digestive issues. Which kind of probiotic do I need? All right. Or I'm having a problem with my menstrual cycle. Do you have any supplements that are going to help me fix that? Or, I have a low immune system. So how much vitamin D do you recommend? So there's all of these, different scenarios where, people have to go from and there's 3 points that you have to get through to really understand what we're trying to do with our perspective. And usually what happens is someone has X health condition. And so the first place they actually go to is they go to, medicine. They go to the medical doctor. And the medical doctor, many times people are left very frustrated. And the reason why is because, just remember, medical doctors are actually looking at whether there is a fire or not. And so many times with the testing and things like that, they're actually they're not looking for the right types of fires. They're not looking for the cause of the fires. They're trying to look at whether someone has a fire or not. And many times you don't have an all-out fire that's going on, but you have some things that are going on that are going to make you feel pretty lousy, but their testing that they do, which is just some standard testing, is not actually finding the fire, okay? It's almost like if you were smelling smoke like in your house, but you couldn't see a fire, and you go ask the fire department, is there a fire in my house? And the only tool they used were their eyes. And so they say, I don't see a fire, and so I guess there isn't one. And you say, yeah, but I smell one. I smell a fire. And they say, well, our only tools are actually if we see a fire or not. They're not using their sense of smell, so if they don't see it, then obviously there's no fire. And you're like, well, what am I supposed to do then? And they said, well, I don't know. Once you see a fire, call us, and then we'll know where to put it out. So you can see that a lot of times people are going to go the medical route first. And many times a lot of people that we see they're very disappointed with the medical route. And a lot of times will say, well, many times people are happy with their doctor until they truly get sick. Then you truly get sick and you realize that it is a completely different perspective. Now, don't get me wrong. It doesn't mean I'd never go to a medical doctor. If I have a fire, I'm going to have them put out that fire. But the main thing that we're trying to do is let's not get a fire in the first place. So let's talk about when we are asking these fire department questions, let's talk about really what the true Carpenter answer is, okay? Because a lot of times what we're asking for is, well, I don't want to take drugs. I'm not a pill pusher. I'm not a pill popper. So I don't want to take medications. So what's the alternative? Do I just take the alternative, which is some kind of magical supplement that is going to take the place of a medication? And I will say this, there's nothing that's more powerful than a medication. because a medication has the ability to be able to manipulate. And supplements don't have the ability to be able to manipulate. They only restore. It's all they do, which means that if you're deficient in it, it's going to help you. If you're not deficient in it, it's not really going to help you. So we have to start looking at health from a lot different perspectives. The question I'm going to ask you is this: are you trying to put out a fire, but just more naturally? All right. Let's say you do, in fact, have a fire. So you have a fire in your house. You call the fire department. And again, you're going to call the fire department when you have a fire. You're not going to call your dentist. You're not going to call me. You're not going to call, the place where you get your car serviced. You're going to call the fire department because they have the right knowledge, they have the right tools in order to put out the fire. But let's say they come and you're like, well, wait a second. You're going to put water on my house? Well, that's going to destroy my carpeting. That's going to destroy my walls. That's going to destroy the picture of my kids. You're going to break windows. You're going to break down the doors. You'll probably bust through some walls in order to try to put that fire out. I don't want all that collateral damage, which happens when doctors try to put out fire with drugs and surgery. So the next question is people are going to say is, okay, can you put out the fire, guys, but can you do it maybe a little bit more naturally? Say, do you have any organic water, or maybe do you have a hose and an axe that's not going to do as much damage? And so the thing is what brings a lot of people into chiropractic and the wellness way and everything that we do is that they don't want to put the fire out with all the collateral damage, but they want to put the fire out a little bit more naturally, which turns into, I don't want to take medications. So what do you got for me? You got something that's simple, easy, that's just a quick fix. And yes, this is the one adjustment that's going to absolutely just change my life. This is the magical exercise. This is the magical supplement that's going to take all of my problems away. And guys, when people are coming in, we are dealing with years and years and years of poor function, years and years of just things not working the way. And a lot of times patients don't see the symptoms. They don't see the signs that things have been going wrong for a long period of time. So my question to you guys is this, are you just trying to put out a fire, but you're just trying to do it more naturally? We call it actually the Dr. Oz approach. And you know what I mean by the Dr. Oz approach, which means, Dr. Oz says, hey, you don't want to take medicine, I get it, let's do something natural. So if you have high cholesterol, go ahead and let's take CoQ10 red rice yeast, and let's take some B vitamins and maybe some omega-3 fatty acids, and maybe that will work. And so a lot of times people just run out and they just start taking all of these different supplements without really trying to get to the cause. So they really don't care about getting to the cause as much as they just want to put out the fire with as little effort as possible. And that's just trying to take this for that when it comes to supplements. I'll give you a perfect example. This is an actual supplement list that came from somebody, a real patient, okay? And this is a list of her supplements. There's 45 of them. Let me say it, there's 45 supplements, all right? And the reason why she was taking 45 different supplements is that she had a symptom that she thought you would have to take a supplement for. So it was literally just, I have this, I will take this. I have this, I take this. I saw this on a test, I take this. And it is absolutely exhausting to try to plug and play when it comes to supplements, when it comes to your health. And so we don't plug and play. That's the easy thing. The hard thing is to know when, where, and why, when to say yes to this and when to say no, and some of the things to actually attack first, and some of the things to actually start to address down the road once we've actually have done some basics and done some foundational work. 45 different supplements. Now, yes, this helps. I mean, we have people who come in and they're on 13 different medications. The medical doctor is just plugging and playing, saying high cholesterol, go ahead and take this. Low thyroid function, go ahead and take this. High blood pressure, go ahead and take this. Problems with constipation, go ahead and take this. You have problems with pain, go ahead and take this. And this is why so many people end up with polypharmacy and all these different things that are taking place, and they're no better because all they're doing when it comes to their health is just thinking that, well, you can just plug and play for all of these different symptoms. But we do that too when it comes to plugging and playing with supplements and things like that. So I'm going to give you an example. And this is of a patient. So I had a patient who came in last week, and her main complaints was 57 years of age. She says, I have no energy and I have osteoporosis. So here she is, no energy, osteoporosis, and she said, I need you to fix me. Get me back my energy and help me with my osteoporosis. Well, guys, if you actually look at osteoporosis, there's a lot of different reasons why someone could have osteoporosis. This is not, very rarely, this is not getting enough calcium, vitamin D or magnesium, vitamin K, or any of those things that are going on, or maybe even vitamin C. Yes, it can contribute to that, but my goodness, there are people in other parts of the country or other parts of the world that they eat just as bad as Americans, yet they don't suffer with the osteoporosis that we do in the United States. So, but really what she wanted is, I want a pill that's going to fix my energy. I'm going to take a pill in order to fix my osteoporosis. The reality is that when I started digging deeper into her past history, she had, for a very long time, chronic issues with acid reflux, okay? I guys understand is that if you have problems with acid reflux, you have a problem with your stomach being able to produce enough acid from acidifying the gastrointestinal system. And what that means is you're going to have a hard time breaking down your proteins. You're going to have problems with a lot of GI overgrowth because of the low acid. You're going to have a problem actually absorbing minerals into the body with low acid. You know, things like potassium, things like B vitamins, things like iron and calcium, which you need in an acidic environment. So you had chronic bloating. She had, in the past, problems with her thyroid nodules, chronic neck pain, a scoliosis. But now you keep even going further. She had rosacea. So she had the inflammation all over the cheeks and the nose, on the face. And she also had very dry eyes. So here she was, and she was taking a cream for her rosacea. She was taking eye drops for her eyes. She was taking a PPI, proton pump inhibitor, for her acid reflux. With the thyroid nodules, the doctor kind of looked at that and said, well, you see there's nodules, but your quote-unquote thyroid levels are normal, and I guarantee that they weren't. Chronic pain, so taking Advil and things like that. And so, when you look at what she was actually taking, is she was taking bioidentical hormones, and this was actually for the osteoporosis. And Lord knows, if you look at just the absolute devastation that took place over the last 30 years of giving women bioidentical hormones and breast cancer, it has been absolutely tragic, because it has been the cause of hundreds of thousands of cases of breast cancer in the United States. She was taking an antibiotic cream for her face, eye drops for her dry eyes, but was also taking 12 supplements. Yet when you look at it, she still had no energy, she still had osteoporosis, and she still had all of these issues that were going on. And the reason why is because no one's actually sat down and looked at the big picture, what was going on with all of these different organ systems, trying to make sense of it, and how to get her body to heal by taking away all of those stressors. Listen, how many times have we said, I don't have any energy? Maybe I need ashwagandha. Maybe I need some licorice root. Maybe in order to get my energy, I need some caffeine in the morning. I don't have any energy. Maybe I need my super, proprietary adrenal energy pill with L-theanine and B vitamins and rhodiola. And I've seen some, and I look at them and I'm like, those are cute. Those are really cute. But guys, you could do all of those things, and heck, they may even give you your energy temporarily, but if you still remain sick, the best supplements are still not going to work. Heck, she was already taking 12 of them, yet she still didn't have the energy. So when we look at all of this, really where the art is trying to figure out, gosh, where you should start first. And this is what I told her, where we need to start first is, we need to start first on the gastrointestinal system, since that is actually what's actually involving inflammation, what's involving the absorption of minerals, the absorption of foods. We have to start getting the inflammation down as much as possible. So we recommended, we got x-rays on her in order to look at physical stressors. So yes, there was issues happening in the spine and the nerve system. But we said get a food test, number two. And number three, you actually need to get an autoimmune test. That's the first thing. And we need to figure out, are there any autoantibodies to her stomach parietal cells? Are there any autoantibodies to her thyroid? Are there any autoantibodies that are involving things like lupus and scleroderma, which a lot of times you will see rosacea, and you will also see are there any kind of autoantibodies involving actually the tear ducts in the eyes. So that's actually where we actually started, and it wasn't just here is your adrenal pill, and then here's some more calcium and vitamin D and some vitamin K, and hopefully that works, because I'm going to guarantee you she's already done all of that, and in fact, they're actually pumping the bioidentical hormones into her. She said, I felt great for 3 months and now I feel sick again. So you understand how many of the layers you have to go through in order to work on getting a person well. But let me give you some examples when it comes to health of how we have the Fireman, how we have the holistic Fireman, and then we have the Carpenter answer that is needed, okay? So let's say someone's having headaches. And in fact, I've never had a case of headaches that has not resolved or hasn't gotten better. But many times we're the last bastion before they have no answers left. So let me ask you a question. If you go to your doctor and you're saying, Doc, I'm having some headaches, the first thing that they are going to think of, let's say you're having a migraine, the first thing they're going to look for is they're going to look for a brain tumor, okay? Now, are there times where people have headaches from a brain tumor? Absolutely. Doctors can find that fire that's going on, but we are talking about literally 1 in 500 cases where someone's having headaches that's caused by an actual brain tumor. But the first thing that they say, instead of thinking horses, they're thinking zebras when they hear a horse beat. So just think of this. If you hear something running after you and it sounds like horses, and you are living here in Yorkville, Illinois, you should think horses first. You shouldn't necessarily think zebras, but a lot of times doctors are going to go to the exotic first because they're looking for a fire. If they don't see a brain tumor after doing an MRI, after doing a CAT scan and getting a bill for $19,000, is they're going to say, yes, you have headaches. No, we don't know why. Here, just take some Advil or maybe just take some kind of Imitrex or migraine medication. And people say, well, it kind of took the edge off, but I don't like this. I don't like the fact I'm still having migraine headaches and still don't feel very well. So then what they do is then they go to the holistic Fireman. So they might go to someone who is a quote unquote holistic doctor. Maybe someone who's taken a weekend course on holistic doctoring. And so they say, well, if they have migraine headaches, then we've heard that things like the research says that turmeric works, or megadosing on B vitamins, or maybe getting a massage. We have a lot of people that they do that. And they're like, well, I guess it helps, but yet you still are getting the migraine headaches. I want you to think about it. If you are feeling better with headaches from going to a holistic Fireman, thank God, that's good. The only problem is what would happen if you took away the turmeric? You took away the B vitamins. You didn't allow to get a massage every week in order, that you're getting right underneath the skull. There's a reason why that's happening. You take that away, the headaches are going to come back, which means you still haven't really addressed the fire. It's just that you are sprinkling it with a little bit more natural water. So when people say, I'm having headaches, what do you got for me? It's not the one adjustment. It's not the magical turmeric. It's not just the magical one thing. Ultimately, what you got to do is you got to figure out why this is happening. And what we do is we do it with testing. So let me ask you a question. How many of you have actually gotten x-rays? We take some of the most comprehensive x-rays in our office, especially with people when they're having headaches. So what do you x-ray? Well, you x-ray the neck. Many cases of x-rays or headaches are actually coming from the upper cervical spine. So there's been some kind of trauma. There's been some kind of injury that's taken place. So side view of the neck, front view of the neck, open mouth, flexion extension to see what's working and what's not working. But there's other reasons why you can have headaches as well. You can have a lot of inflammation. In fact, I had a gentleman who came in who was having exercise-induced migraine headaches. So yes, there was an issue in the upper part of the neck, but there was also a lot of swelling in the abdomen. So I said, hey, you need to at least get a food allergy test, and he couldn't understand why. Well, the reason why is if you have a lot of gastrointestinal inflammation, you're going to have a lot of blood in that area in order to bring the immune system in order to be able to handle it. which means if you got a lot of blood around the gastrointestinal system that's pooling, and then you exercise with a lot of blood and bloating around the abdomen, it's very hard to get enough blood to the brain when you are exercising because it demands a higher amount of oxygen. You starve the brain of oxygen, then one of the things that's going to happen is you are going to have a really bad headache, an exercise-induced migraine headache. So think about it. We're looking at the x-rays, we're looking at food allergies, ladies, also looking at what's happening with the hormone picture, what's happening at the liver, how is the liver metabolizing your hormones, how is it doing all of those different things. So you realize even before you start correcting those things, you first need to figure out why it's actually happening. Now we also have a lot of women who come in and say, I want my hormones balanced. Please balance my hormones. Because remember, hormones don't make you sick, but they'll make you feel sick. Hormones are the response to what is happening to inflammatory triggers and stressors inside the body. It's only the body responding. It's not the body actually causing you to be sick. So let's say you go and you're having problems. You're having problems with your menstrual cycle, or you're having problems with menopause, okay? Hot flashes, you feel lousy, awful. So you go to the doctor, and let's say you're having a problem with your menstrual cycle, and they're gonna say, well, just go on birth control, for example. Just do birth control. And you know how many ladies have been put on birth control for having a problem with their menstrual cycle, and yet the doctors never, not once, has actually measured their hormones. They've never measured all of the different estrogens. They've never measured the progesterone. They've never measured testosterone and all the testosterone intermediaries. They never looked at things like homocysteine, C-reactive protein, to look what was happening and what could be causing these hormones to down-regulate, up-regulate, or start to adapt to the body's environment. Or if you're having issues with menopause, they'll go and they'll say, well, you just need to be on hormone replacement therapy. Let's put you on Premarin, which is pregnant mare urine. It's what it's called. So they're going to take estrogen in order to try to keep their bone mass, prevent osteoporosis, and this is what had such devastating effects in postmenopausal women with breast cancer. And other people say, well, I don't like that answer. Let's go to a holistic fireman. There's still a fire, but let's just use something that's more natural. So a lot of times what they'll do is they'll just measure estradiol, they'll measure progesterone, they'll see a discrepancy in between. A lot of women post-menopause, they just put them on progesterone. So they'll give them a progesterone patch. And so what happens is they feel better because the progesterone levels have gone back up, and now they're actually getting closer to what their estradiol levels. And I always say, if you got a problem with estrogen metabolism, don't raise that progesterone because all you're doing is just creating more problems and more issues. So what you need to do is figure out why is progesterone low, and then number two, why are you hanging on to so many estrogens? So is it the fat cells? Is it the liver? You know, what is the reason why you tend to be so estrogen dominant? What are your insulin levels at? So the Carpenter answer when someone says, Dr. Nate, I need you to balance my hormones, is this: we need to test. We need to test inflammation. We need to look at your mental stressors. We need to look at how the liver is metabolizing your hormones. And many times it's the answer that they don't want to hear because they want their answer to be simple, plug and play, and my life goes back to normal. And that is rarely, if ever, the case. What about digestion issues? When people say, I'm getting bloating, or I have reflux. I have diarrhea all the time. So what happens is that they go to the fireman, they go to the MD, they're going to do an upper GI or a lower GI. They might do a CAT scan. They might put that person on medications. And many times the medications for gastrointestinal issues are really just things in order to lower inflammation like cortisone, or things that are just going to absolutely knock out the actual immune system. This is why when you look at like the GI and the autoimmune issues associated with the GI, their only answer is to try to lower the inflammation many times by giving them medications that actually knock out the immune system, which is why anytime that you look at any kind of medication, when it comes to autoimmunity, look at the side effects. And one of the side effects is you have a higher risk of having an infection or cancer. And the reason why, take the immune system down, knock out the immune system, and you'll see cancer go up and you'll see a risk of infection go way up as well. So if those things don't work, then the next step is let's just remove the organ. If it doesn't work, keeps getting worse, then just remove the organ. So we'll remove some of the intestines, we'll remove the large intestine, or hey, if it's a lady's ovaries, we'll just remove those too. Hey, heck, let's just take the uterus as well. You don't need them anymore if you're in menopause, but that's actually not the case. So then a lot of times people say, well, I don't like that answer, so I'm going to go on a probiotic. Guys, you know how many people just think that just taking a probiotic is going to make their life perfect and back to normal? And it's no different, guys, when you have problems in the intestines, that taking a probiotic will not work if you have a problem with inflammation, you have a problem with where the microbiome actually lives, which is in the mucus layer in the intestines. If that has been inflamed, that mucus layer gets thinner and thinner. There's nothing for that probiotics and for that bacteria to actually live in anymore. So a carpenter is going to say this, all right, well, let's look at food allergies. Let's look at the inflammatory responses. Let's look at the types of foods that you are reacting to. Because remember, on a food allergy test, one of the clinical pearls is, well, is it fats? Is it proteins? Is it more carbohydrates? And that will actually show the organs that aren't breaking down the food the way that they're supposed to. What about getting a stool test? What about looking at inflammatory markers? What about looking at mental and physical stressors? So even with GI issues, it can be related to mental stress. It can be related to not getting enough sleep. It can also be related to the spine and to the nerve system, guys. Do you know that when you look at where the nerve system is at, that controls fight or flight or rest or digest? So if you have something happening in the neck and it's actually causing issues with what's known as the vagus nerve, you will not be able to get into rest and digest, and you will stay into fight or flight. When you're in fight or flight, good job trying to break down your foods. Good job trying to secrete enough stomach acid. Good job trying to move your bowels. And now you got any junk in there, that's going to sit there and it's going to fester and it's going to create other problems. So we have seen people when their main stressor was actually coming from the spine where GI issues healed. Not that I did it, but their body did, because we were able to get them out of such a fight or flight response. And so that's why you have to start looking at the whole picture. And this is why we will always talk about the Swiss watch. It's the Swiss watch, and your body works like a Swiss watch, okay? Pay attention. Your body works like a Swiss watch. And this is why the whole idea of getting sick and going to a specialist, because all a specialist is going to do is they're going to look at one organ system. I have a rash on my skin. I'm going to go to the dermatologist. They're going to look at that and say, wow, looks like you're having some inflammation on the skin. You're having an allergy. Then what we're going to do is we're going to give you a hydrocortisone cream that's going to knock out the immune response at the level of skin. And meanwhile, the immune response is saying, please help. I have issues here and I'm trying to get rid of all of these different things. It's the body just doing exactly what it was supposed to do. So we keep going to specialists. We go to the dermatologist. We go to the orthopedic. We go to the GI specialist. We go to the endocrinologist. We go to the heart doctor. We go to the pulmonologist. We go to the immunologist. We go to all of these different. We go to the neurologist or the neurosurgeon. We have all of these different specialists who actually focus on one organ system and give you a medication to try to fix that one organ system. But they don't realize is when I try to fix one organ system, it actually will affect every single organ system in the body, which is why there's so many other quote unquote effects when you take one medication. And in fact, I say this, a specialist is someone who knows more and more about less and less until finally they become an expert in nothing. So guys, you have to be able to put the big picture together on how every organ system in the body starts to work together. And this is why, yes, the big toe can control the heart. And people say, see, I told you, you're a quack. You think the big toe actually controls the heart. And I say, well, give me a hammer. I'm going to smash your big toe, and then let's look at your blood pressure, and if it goes up, I'll prove my point. See, the reality is that getting a person better really has less to do with about trying to manipulate and trying to fix things as much as it actually is already knowing that the body is never making a mistake. It's merely adapting to your environment. So what do we have to do? We have to get the body to adapt to health versus always trying to adapt to disease, which many times all we're doing is we're just removing the stressors from their stress bucket. So I want you to think about this. If you're on 50 different supplements and you're not getting better, guess what's happened is that those supplements haven't done anything in order to remove the reason why. It hasn't done anything in order to remove the stressors. So what happens if you have this bucket and it is filled up with so many different stressors, and it gets to the point where this bucket starts to overflow and the body starts to go into what's known as adaptive physiology? It will never ever be able to heal if those stressors are more than the body's ability to be able to heal. So what do you have to do? If the body knows how to heal, if it can heal a cut on your knee, it can heal your reflux. It can heal what's happening in the heart. It can heal your hormones. It can heal your headaches. It can heal your gastrointestinal system. But what you have to do is make sure that you're not constantly beating it down. You have to start removing the stressors out of that bucket to the point where the body says, all right, now I have this much less stress, and now I can actually start to heal those different things. So you have to work on taking those stressors out of your stress bucket. So what are your physical stressors? What are your mental stressors? What are the chemical stressors that are going on? And every single person is different. Every single person is unique. There's no two people that are the same. No one gets the same exact protocol unless their tests are exactly the same. So there's an infinite amount of possibilities on where you can take a patient, and that is why you should be working with a Wellness Way doctor and quit trying to do it on your own, okay? Quit trying to do it on your own. It's the difference between you getting there in 19 years and you getting there in maybe 6 or 12 months. So, you have one life. How long do you want to live and enjoy and be healthy for? So here's my question, guys. Are you trying to put out a fire, but you're just trying to do it more naturally? Are you the person on 12 supplements and you're still sick? Are you the person trying to take the magic adrenal pill, or you're trying to take the magic probiotic, or you're trying to take the magic liver detoxifier, and all you're doing is just saying, oh, I don't want to take a medication, I want it more natural, but really what you're trying to do is you're still trying to manipulate your health, except not with medications, just with supplements. And guess what? Medications will always manipulate a supplement. It will always do that. So the only time you need a supplement is if you're actually deficient. And how do you know? You need to always test. You need to always test, which takes me into this, guys, coming up Saturday, February 27th, right here at Exemplify Health Center. We're going to be doing the Wellness Way approach to GI health, all right? Dr. Nate, I don't care about my GI. When you understand the GI system, you will understand that when this gets sick, how this causes a cascade with that Swiss watch principle, how it causes a cascade of all of these other things in regards to the immune system, to inflammation, to so many different things. It's really, really unbelievable. So we're going to be talking about GI health and how, literally, when that starts to go, how it will affect everything else inside of the body. I'm actually going to go over what is amazing. The amazing thing is that when you look at some of the issues with the end stage of disease when it comes to the gastrointestinal system, things like Crohn's disease, things like celiac disease, when you look at anything that's inflammatory, especially down in through the lower part of the intestines, even colon cancer for that matter, is that you'll see that really the only thing that medical doctors can do is they can only try to put out the fire, which is going to be things like antibiotics. They're going to be things like anti-inflammatories, steroid meds, autoimmune type medications, and then finally it's just go ahead and let's just remove the organ. So it's really just try to douse it, try to put out the fire, and if that doesn't work, we're going to take it out. But remember, if the organ is sick, it's not the organ's fault. Something else is going to be happening. So this is going to be Saturday, 10 o'clock, in-person event, a.m., at Exemplify Health Center. For those of you that are in the Yorkville and surrounding areas, please come to it. You may be asking this question, hey, what are some of the symptoms of poor gastrointestinal health? Well, here are some of them. How about colic in babies? When babies are colicky, they have a problem in the gastrointestinal system, specifically the stomach. So they're having all kinds of problems with the stomach, and they're having all kinds of gastrointestinal swelling, and it hurts the baby. That's why they are colicky, and that's why they're crying all the time. How about reflux and bloating? Not normal. What about sinus congestion? So yes, if you are having issues with sinus congestion, this is an issue in the gastrointestinal system. What about having constipation, diarrhea? What about having problems with asthma? What about problems with chronic joint pain, acne, eczema, psoriasis? How about problems with brain fog? Because if you look at the immune responses that take place around the gastrointestinal system and the inflammatory responses take place, that can become systemic, which is why it can cause joint pain. It's why it can cross the blood-brain barrier and cause brain fog. It's also why it can cause poor sleep if you're having inflammation of the brain, because it's going to affect your brain hormones. And yes, it's going to be causing depression and anxiety, because remember, it's not a brain issue. The brain is merely a receiver for what is happening in the body. Where does most of your serotonin production occur? It's actually in the gastrointestinal system. If that is inflamed or if that's chronically sick, it's the difference between having anxiety and the difference between having depression. Or how about thyroid issues, which is where a lot of your thyroid hormone conversion takes place in the gut and in the liver, or low adrenal function. So guys, there are so many different things that can take place when it comes to the gastrointestinal system. But again, it's why we look at things from a Swiss watch perspective. How literally, if the gastrointestinal system is off, there's so many other things that I can do in order to make you sick. So hopefully, guys, that makes sense. Hope you guys enjoyed today. And yes, I know that people were asking, this is an in-person event so far. Maybe down the road, if we have time, we can make it a webinar. But always too, guys, is make sure that you follow up with your Wellness Way doctor. They can guide you through all of this. Now, just remember this, is that you don't have to know all of this, but you do need to know the right person who knows how to take you through the right journey. So more important than actually knowing this is knowing who to get the right leadership and coaching from, so that you can start actually getting better. There's too many people out there that are trying to learn everything and trying to do it on their own. And so what happens is you keep learning, but you don't get the opportunity to actually enjoy the benefits by working with a doctor who knows how to put the pieces of the puzzle together quickly so that you can start enjoying your health. So guys, hope you have a great Monday. Hope you guys stay safe, stay warm. I actually will be heading home and spending some time with the kids while we enjoy a little bit of time off. But of course, I have to make it up on Tuesday, Wednesday, Thursday, Friday, and Saturday, all right? So guys, I always appreciate you on. Make sure that you share this with other people. And if you have any questions, I'll do my best to go back and answer those questions if I haven't already. So guys, be well, enjoy your Monday, enjoy the rest of the week, and we will talk to you guys soon.